Bites and stings. Let's look at snake bites. So most snake bites are non-poisonous. Vipers are the commonest cause of poisonous snake bites in tropical Africa. Others are the cobras and water snakes. In all cases of snake bites, venomous or non-venomous, should be observed for at least 6 hours. Identify the type of snake if possible. Don't rely too much on fang marks. However, multiple fang marks usually indicate a non-poisonous bite, whereas one or two fang marks suggest a poisonous bite. It is important to determine whether envenomation has occurred. The role of tourniquet and incision over the site of the bite are controversial issues and are to be avoided. The causes are snakes. And the symptoms are pain, bleeding, swelling, fainting, dark colored urine, headache, muscle ache, fear, and loss of consciousness. Signs that are usually elicited: poisonous snake bites, cardiovascular, could be hypotension, shock, cardiac arrhythmias, spontaneous systemic bleeding from bite sites, mucosa and old wounds, and hematuria. Also, dark urine from myoglobinuria and intravascular hemolysis. Neuromuscular will be cranial nerve paralysis, ptosis, ophthalmoplegia, slurred speech, and bulbar respiratory paralysis. Could be drooling and inability to breathe properly, impaired consciousness, seizures, meningism, tender and stiff muscles. Local effects: rapid progression of swelling to more than half of bitten limb, blistering, necrosis, and bruising. Also, facial compartmentalization on bitten digits. Investigations are full blood count, renal function test, 20 minutes whole blood clotting test. You leave 2 to 5 milliliters of blood in dry test tube. Failure to clot after 20 minutes implies incoagulable blood. And you do liver function test. So the main treatment objectives are to relieve pain and anxiety, to support the respiration and circulation if indicated, to counteract the spread and effects of the snake venom, and to prevent secondary infection. Non-pharmacological treatment: give first aid, mobilization or splinting of the affected limb. Do not move the limb that has been bitten, and the more it's moved, the faster the poison spreads. You carry the person on a stretcher and tie the limb to a straight piece of wound. If ice is available, wrap pieces in cloth and place it around the bite. You clean the wound and reassure the patient. At the hospital, bed rest, reassure, keep warm, assess patient's airway, breathing, and circulation as the ABC of resuscitation. For probable venomous bites, you clean site of the wound with antiseptic lotion or soap and water. Do not attempt to suck or make any incision at the site of the bite. You leave wound open. Puncture wounds are especially likely to be infected. If the snake is identified as non-poisonous, or there is absence of swelling or systemic signs after 6 hours, you reassure the patient. Surgical debridement when required. So pharmacological treatment, first-line treatment, you give anti-venom appropriately. So indication for anti-venom treatment: the presence of symptoms and signs of local and systemic effects of envenomation. You give anti-snake serum, that's ASS, polyvalent. So you have resuscitation tray ready. Give adrenaline 1:2000. Test dose 0.2 milliliters subcutaneous to test for anaphylaxis, and ASS as anti-snake serum 50 to 100 milliliters as 5 to 10 ampoules depending on severity by IV drip in 0.9% normal saline or 5% dextrose over 2 to 4 hours. You monitor signs and repeat as required. Never inject antivenom into toe or finger. You monitor patient and correct hypovolemic shock with crystalloids or colloids or blood, the effects of hemostasis as clotting factors, fresh frozen plasma and platelets, also respiratory distress, oxygen intubate or ventilate, anti-tetanus therapy, tetanol IM 0.5 milliliters stat, and diazepam oral 5 to 10 milligrams stat. For pain relief, we give paracetamol oral in adults 500 milligrams to 1 gram 6 to 8 hourly. In children 6 to 12 years, we give 250 to 500 milligrams 6 to 8 hourly. 1 to 5 years, we give 120 to 250 milligrams 6 to 8 hourly. 3 months to 1 year, give 60 to 120 milligrams 6 to 8 hourly. Or morphine IV IMSC in adults 10 milligrams stat. In children more than 2 years, give 200 micrograms per kilogram, and less than 2 years 100 to 200 micrograms per kilogram. In prevention of secondary infection, give amoxicillin oral in adults 500 milligrams 8 hourly for 5 days. In children 6 to 12 years, give 250 milligrams 8 hourly for 5 days. 1 to 5 years, give 125 milligrams 8 hourly for 5 days. 1 year, you give 62.5 milligrams 8 hourly for 5 days. And the corticosteroids are of little or no value during poisoning except in treating anaphylactic crisis. So avoid venopuncture in size of generalized bleeding. So referral criteria: refer all patients with respiratory failure, heart failure, renal failure, muscle paralysis, muscle necrosis, bleeding, or intravascular hemolysis to a regional hospital for specialist care.